and the application of epidemiological methods in nutritional research, as well as assess and surveillance of nutritional status at the population level. And the course is divided into 6 knowledge areas. We have knowledge area 1, which is about descriptive epidemiology. Knowledge area 2 is history of disease, level of prevention and epidemiological studies. Knowledge area 3 is population screening, biases and confounders, and ethical considerations in epidemiological research. Knowledge area 4, intervention strategies and nutritional assessment. Knowledge area 5, nutritional surveillance and challenges in using nutritional surveillance system. Knowledge area 6 is about evaluation of surveillance system, sources of surveillance data, and epidemiology of non-communicable diseases. But you can have like knowledge area, one knowledge area can have up to like 4 chapters. So it is one of the courses with a lot of areas to cover. So you have 6 knowledge areas, but sometimes during this 1-hour lecture, we cannot cover even 1 knowledge area. So we will see how it goes, but I'm sure you can all access your Moodle account where there is a study material where it covers all the courses, all chapters which you are supposed to cover for this course. So knowledge area 1 is about descriptive epidemiology, and it has 4 chapters. The first chapter is about the introduction to nutrition epidemiology. The second chapter is about uses and limitations of nutritional epidemiological data in nutritional research. Chapter 3 is about steps in investigating an outbreak. And chapter 4 is about the descriptive epidemiology. Introduction to nutrition epidemiology. Nutrition epidemiology is the assessment of diet and its relationship to disease etiology in population. Nutrition epidemiology is a relatively new branch of epidemiology which focuses on understanding the relationship between diet and long-term health and disease. Epidemiological studies directly relating the intake of various dietary components to the risk of disease among humans, complemented by laboratory investigations and mechanistic studies, will play a critical role in guiding individual food choices and public policy. This is an introduction of nutrition epidemiology, whereby it shows that you need to know how to understand the relationship between the diet and the health outcome from that diet. Because you can be exposed to certain agents like, sorry Tom, niko kwenye kipindi, anasemaje? Basi mwambie tufanyie 100. Okay, lakini I'll come back to you nikimaliza lecture. Asante. Okay. So when we eat our food, normally we are expecting that food to be safe for us, to nourish our body, to provide nutrients to our body so that we can grow, so that the body can function well the way it is supposed to function. But sometimes when we are eating a contaminated food, it can have an effect in our body. For example, if you eat food which has salmonella, so at the end you will be sick. You can get food poisoning. But when the food is containing a certain chemical, also it can be toxic to you. But when the food has deficiency in some of the nutrients, your body can also react, that the body will show symptoms that it miss maybe a vitamin C or vitamin B. So that means everything which we take in, it has consequences in our body, whether positive or negative. So with nutritional epidemiology, we want to know if somebody maybe falls sick after eating a certain type of food. As a nutritionist, you need to know how to assess and determine what was the component in that particular food. So during that assessment, during that evaluation, that is what we are saying, you are doing an epidemiological study, that you want to know what was in that particular food. What was the contaminant? Was it a pathogen? Was it a chemical? Was it maybe something else, physical stuff like a glass or plastic or something like that? So nutritional epidemiology will enable you to understand what is the contaminant depending on the symptoms which will be shown by a particular person. And then you will go further and wanted to know maybe the causes where that contamination occurred in that food value chain, so that you will be able to intervene. So that is a very important as far as nutritionist knowledge is concerned. You cannot just be treating people. You cannot even treat someone if you don't know what was the causes of the symptoms or of the condition which the person have. So the objective is to explain the historical evolution of nutrition epidemiology, understand various terms used in nutrition epidemiology, elaborate advantages and disadvantages of nutrition methodology. So this chapter, you will cover those 3 items, and you have to understand where did these terms epidemiology come from. It started a long time ago, and many scientists was working on the issues related to food and health. But one of them was John Snow. John Snow in 1849 formulated and tested a hypothesis concerning the origin of an epidemic of cholera in London. One of the bases of the available data, Snow assumed that cholera was transmitted by contaminated water through a then unknown mechanism. So Snow put hypothesis that I think this cholera is being transmitted by contaminated water. But how? How is this happen? Nobody knows. So he observed that death rates from cholera were particularly high in areas of London that were supplied with water by the Lambeth Company or the Southwark and Hawkswell Company, both of which drew their water from the Thames River at a point heavily polluted with sewage. So there was a sewage system which were pollute the river, and they used that water from that river. And that's why they were having cholera, because the water was contaminated with Vibrio cholerae. But nobody knew that the water was the source of cholera. Between 1849 and 1854, the Lambeth Company changed its source to an area of the Thames where the water was quite free from the sewage of London. And then the rate of cholera declined in those areas of the city supplied by the Lambeth Company, while there was no change in those areas receiving water from the Southwark and Vauxhall Company. Finally, Snow concluded that the source of cholera outbreak was the contaminated water, because it was like there was a control group and the group which were intervened by the source of water. So it makes Snow understand that the main causes of cholera in that area was... Hello, Hassan, can you please mute your device? Are we together?
Yes, madam.
Can I proceed?
Yes.
Is it clear with the historical perspective of epidemiology how it started?
Yes.
Definition of epidemiology. Epidemiology, the study of the distribution and determinants of diseases and other health outcomes in human population. Epidemiology also deals with the natural history of diseases, and it can provide evidence that contributes to their prevention. Therefore, when we are talking about the epidemiological studies, sometimes we want to know how that disease started, so that it will end, how is that disease progress. So when you understand very well the etiology of the disease, from where it started and the way it progressed to a human body, then it will be easy for someone to control that disease and to understand very well that where exactly the intervention should take place in order to prevent that particular disease and improve public health. And it is not only disease which can be caused maybe by contaminated water, it can also be a disease which is caused by a deficiency of a certain nutrient. Epidemiological investigation of a deficiency disease. Investigation of pellagra disease, lack of vitamin B3, whereby the symptoms is inflamed skin, diarrhea, dementia, and sore in the mouth. Epidemiology provided the key clue to solve the problem and identified a practical means. Because at first, people were suffering from pellagra, but at the same area where there were other people who were not suffering from pellagra. So an epidemiologist was trying to think, what is the cause of this pellagra? And then they came to realize that the community which are suffering, they have members from the same household who was working in one of the industry, where in that industry, they were provided with food during breakfast, during lunch. They were getting food from the industry. So that means at the industry, they were receiving a balanced diet, all the nutrients, where at home, there was lack of some of the food groups. And that's why they were suffering from pellagra. But they had to assess and understand that situation. And then they come up to understand that it was lack of vitamin B3. So they started to provide foods like meat, milk, etc. And that problem were solved. So that is why the epidemiological study is very important in our community. Epidemiological investigation of chronic diseases. Epidemiological studies in a wide variety of human population have consistently associated low intakes of fruits and vegetables with the increased risk of many types of cancer. The mechanisms by which these foods may protect cancer are incompletely understood, and the active agents have not been conclusively identified. Nevertheless, the epidemiological evidence provides a reasonable basis for action and a sound basis for further research. So we all understand nowadays that eating fruits and vegetables is very useful for our health. And we know that it helps to prevent or reduce the rate of cancer. How do we know that? It is because of other epidemiological studies. They come up with those hypotheses and they prove. But the only thing which is different, depending when we're comparing the investigation of chronic disease and maybe the investigation of a deficiency disease. For deficiency in disease, you will know exactly that there is lack of vitamin B or there is lack of iron, whereby someone can be supplied by maybe folic acid or those iron pills. But for chronic disease, we don't have a causative agent. It is only the association. We say that if you're taking fruits, then the rate of getting cancer is lowered. So you can see that although it doesn't give a causal agent for cancer, but it helps to reduce the rate of cancer in the community. So that's why we are saying epidemiological studies are very, very important to improve the health of the community, to improve their living standards, to improve their hygienic condition, so that they can prevent some of the diseases. Goals of nutritional epidemiology: monitoring the food consumption, nutrient intake, and nutritional status of a population. So we are doing nutritional epidemiology. Why? Because we want to make sure that our community is healthy. The nutritional status of our population is good. How to assess nutritional status? You don't just measure their nutritional status. You have to know their eating habits, their dietary pattern, so that you can be able to advise them depending on what you will get in their nutritional status levels. You can also generate new hypotheses about diet and disease, and then to produce evidence that supports or refutes existing hypotheses, and to assess the strength of diet-disease association. Sometimes you can make your hypothesis. Maybe you can go to a certain office and find them, they all have a very, I can say, the appropriate body weight. And then you want to know why. How comes there is no one with obesity in this office? And you can decide to do the dietary assessment, or maybe apart from their dietary assessment, but also their normal way of living. Do they do physical exercises as well? And for that, you can come into conclusion and say if your hypothesis is okay or not. Also contribute to the prevention of disease and the improvement of public health. You will see how it contributes to prevention of disease in other chapters. Advantages and disadvantages of nutritional epidemiology. Advantages: it is direct relevance to human health, because you are not doing like assessing the animals. No, you are assessing the human. Like, you want to know their dietary pattern, you want to know their nutritional status, you want to know maybe if they are exposed to any type of hazardous stuff. So by doing that, it makes the nutritional epidemiology study very useful, because it has a direct impact to human. Epidemiological results are used to calculate direct estimates of risk, which can then be translated into specific recommendations for changes in nutrient intakes or food consumption patterns. Nowadays, people, they live according to the recommendation from some nutritional epidemiological studies. You can find someone, he or she is not a scientist, but she knows that I don't want to eat too much of fat. Why? Because I don't want to become obesity. So you can see the way the results from nutritional epidemiology study can impact on the changes of someone's behavior. So findings from nutritional epidemiology can even have direct impact implication for food processing and technologies. But here we are talking about food direct. But some other studies will also change our behavior because of those results of nutrition epidemiological studies or other epidemiological studies. And you can see, like, now people are very sensitive with HIV. Why? Because of some of the studies. And they know that, oh, I have to practice a safe sex, for example. How can you do that? Minimize number of your partners, use condoms, something like that. But other people, when we are talking about maybe birth control, a lot of women, they decide, others, they can say, oh, I can take contraceptive pills, but others, they can say no. They have said they can have effect, or they can change the hormones in the body. So I will not go for contraceptive pills, I will go for the calendar. So all those are the advantages of epidemiological studies. Although there are advantages, there are also disadvantages. Disadvantages of epidemiological studies: potential for many kinds of biasness, over or underestimation of the strength of an association between an exposure and an outcome. Epidemiologists should be very careful when they are designing their study. Otherwise, they can end up with a bias that the results can be over or underestimation. For example, like when you want to assess maybe those which are prone to the cancer for their lungs. It depends on how you design your study, because otherwise you can tell people that 98% are at risk of cancer cases. Why? Because of the biasness in the selection of samples. Maybe you went direct to the industry. They are making, maybe they are dealing with smoke, something like that, all over the time on their daily basis in their production in that industry. So when you ask them about the issue of cancer, lung cancer, then you can end up with 99% being prone to that disease. But if you know that, and then you have your sample, your design, your sampling very well, then that kind of biasness will not be there. Difficulty in determining whether observed association are causal. If the association between a factor and a disease is not causal, efforts to modify exposure to that factor will not reduce the disease risk. For example, we are saying that maybe drinking too much of alcohol can end up with maybe cardiovascular diseases. But then what about smoking? Also can end up into cardiovascular disease. But what really causes that, we don't know for sure. If we don't know, then we cannot really modify that exposure, because we don't know what specific component that may cause that particular disease. So for that case, we can say that it gives the association, but it doesn't give us any causal effect or a factor that can cause that disease. So, and that can also happen. And as what I have said with regard to cancer cases, simplicity and real-life relevance of epidemiological findings may also be a disadvantage in some circumstances because they encourage the misuse and overinterpretation of data. And we can also find this in real life. People, they still do smoke. People, they smoke up to now. Although we are saying that smoking, it increases cancer cases, the rate of cancer cases. But then maybe I don't know about the data. Are we over-interpret the data, or are we misuse the data, or there are other causes which associate with that? So all those, some of the questions which we don't have an answer, then that is the disadvantages of it. So we're going to chapter 2, which is about the uses and limitation of nutritional epidemiological data in nutrition research. Public health, broadly speaking, refers to collective actions to improve population health. Early studies in epidemiology were concerned with the causes of communicable diseases, and such work continues to be essential since it can lead to the identification of preventive methods. In this sense, epidemiology is a basic medical science with the goal of improving the health of population and especially the health of the disadvantaged population. So objective of this chapter is that at the end, you should be able to describe the uses of nutritional epidemiology and elaborate the limitation of epidemiology. Uses of epidemiological data. Epidemiology and the information generated by epidemiological methods have many uses. These uses are categorized and described below. Population or community health assessment. So we can use epidemiological data to assess a population or community health. Why? Because maybe you will find out that in the certain study, there is a certain disease which occurs more frequently in a certain community. So you have to go back and assess the community health and trying to find out what is the cause for that community to be suffering from a certain disease compared to other communities. Also, individual decisions. Epidemiological data can be used by individual decision. As I've said, that I can stop taking food with high fat content. Why? Because I know that I can become obese. So I'll know how to control the fat intake. But also it can make somebody change the dietary pattern or starting doing particular like body exercise. Why? Because she knows from the epidemiological data that if you don't do exercise, your body can suffer from the obesity, from cardiovascular diseases, and similar stuff like that. Completing the clinical picture. Sometimes you can go maybe when we are talking about like even outbreaks. At the hospital, they can find that in a certain month, maybe they have a high rate of a certain disease. For example, cholera. There is high rate of cholera between a certain period. Why? So in order to completing that clinical picture of high cholera in a certain time, then epidemiologists can go back to study, to observe that community, why this disease is occurring only during certain months. So for that case, you will complete the clinical picture that yes, that's why there is this high rate of this disease, because during this time, maybe there is a lot of rain. Therefore, water will become contaminated and then there is high rates of cholera. Another issue is the users in search of causes, factors which influence one's risk of diseases. We're talking about, for example, malaria. Let's take an example of malaria. Why there is a malaria? We know the factors that can cause malaria. We know that it's the mosquito which causes malaria. So people are using mosquito nets. But why don't we maybe protect the breeding of mosquito? Then you can go to the environment and see like the environment is very dirty. They have lots of standing water, the stagnant water, which is a conducive for breeding of mosquito. So all these other factors can influence a certain community to suffer from malaria. So by understanding that cause, then intervention can be done. Identification of factors that increase or decrease the risk of acquiring diseases. It is similar with what I have explained before. But another issue, we can talk about maybe catering businesses. You prepare your food in a certain area, you pack them, and you go to serve in a wedding, which is maybe 2 hours from where the food is prepared. How do you handle that particular food till the time of serving that food to the people? And in the wedding, people, they start to eat at around midnight. So anything can happen in between. Microbial can grow and people can end up with a food poisoning. So you identify those factors. What may cause this to happen? Identify precursor of disease and syndrome, high blood pressure with heart attack, something like that, or obesity with high blood pressure. So you identify other factors that can facilitate a certain disease to progress. Test the efficacy of intervention strategy. So sometimes the epidemiological data is, you can analyze the data and determine if the intervention which was carried out, was it effective or not effective. Why? You have to collect the data. Before the intervention, you know the situation, how was it? And then after the intervention, you want to know if there was any changes after the intervention. So you test the efficacy of any intervention which was carried out at a particular community. But you can also investigate epidemics of unknown epidemiology. There is a certain condition which occurs. People, they have a certain maybe characteristics after being exposed to a certain contaminant. You don't know the contaminant, you don't know the particular disease. But by understanding those, by studying those characteristics and going back to the source, you will be able to say what type of disease or what was the cause. Evaluate public health programs. We have a lot of public health programs which are going on, starting with the issue of maybe exclusive breastfeeding to the mothers. And so you want to know if they really practice exclusive breastfeeding. So that is epidemiological data. Clarify mechanism of disease transmission also can be done by epidemiology. Explain the molecular and genetic determinants of disease progression. If you know how the disease progresses, how long does it take from where someone is exposed to the onset of the symptoms? So all these are the uses of epidemiological data. Are we together?
Yes, madam.
Yes, madam.
Limitation of epidemiology. Every epidemiological tool has limitations. Awareness of these limitations is crucial to making the correct decisions about what to ask of epidemiologists, which studies to commission, and when and how to interpret findings. Because epidemiology depends on valid data. Insecurity, lack of resources, lack of access, we need a valid data. So you cannot be studying maybe, for example, when we had COVID-19, you cannot take maybe 2 years studying the COVID-19. So by the time you come up with the data, then we have lost a number of people. So in that case, that means we need to have enough resources. You need to have access to the community so that you can go there and assess or do the evaluation. But also, you need to know also the community, who to talk to. Can you go to African community or African house where there is a husband and wife and just starting to talk to the wife and the husband is there? In some of the culture, that is unacceptable. The father of the house need to be recognized. And then you talk to the father and then other members of the family. So that's why we said it also have some limitation. Epidemiology study may take time to be completed. By the time appropriate data are collected and analyzed, the conclusion and recommendation derived may be out of date. I've explained that. Limitation in program evaluation. Policymakers sometimes expect that organizations delivering a certain intervention will be able to demonstrate an impact on health that is unequivocal, traceable to that intervention alone. It is expensive study because some of the study, like for example, when nowadays, like most of majority, I can say, of women of my age, nobody wants to become old. So everyone is looking for supplements that I don't want to become old. I have to take this supplement. I have to take this supplement in order my body to still look like, to look a bit younger. But then those, you can see the effect of those supplements cannot be studied in a short time and say this is how it works. But because of our knowledge in science, we believe that by taking these supplements, my body will receive the recommended nutrients per day. Therefore, I'll be healthy. Therefore, my system will work as normal. It will maybe improve my metabolism, which might be affected by age anyway. So we are trying to recover the system in order to look young and something like that. So that is the limitation, because not everything can be proved in a very short period of time. Epidemiology and the data gathered by epidemiologic methods are routinely ignored. Some of the data are ignored. Why? Because some policymakers, they find it's very expensive to do maybe the intervention. They don't see the effect of that study. So those are some of the limitations of epidemiology. Chapter 3, are we together?
Yes, madam.
My dear, you need to understand all what I'm telling you. You don't have to cram what is in the slide. What I expect you in the examination is to use your own words to write how you understand that particular concept and not cramming maybe a certain definition and bringing it back to me. Are we together?
Yes, madam.
Do not expect questions about definition, defining what is epidemiology. That will be very rare. If it comes, then you are lucky. But most of the questions are competence-based. Want to know how you understand and how you apply that particular skills. So chapter 3 is about the steps in investigating outbreaks. A disease outbreak is the occurrence of disease cases above normal expectancy. So I will not ask you what is a disease outbreak or what is an outbreak. You will be asked, like, in a certain community, there is high rate of cholera. So it is for you to understand high rates above normal. So this is an outbreak. Do you understand me?
Yes, madam.
Yes, madam.
Disease outbreaks are usually caused by an infection transmitted through person-to-person contact, animal-to-person contact, or from the environment or other media. Outbreaks may also occur following exposure to chemicals or to radioactive materials. For example, heavy metals exposure and mycotoxins exposure. So when you're talking about outbreak, don't only confine yourself to person-to-person contact, like COVID, which they say sometimes you can get from another person. But there are diseases that you can get from animal, you can get from the environment. Even COVID, they are said if somebody is not covering the mouth, you can get it from the air if you're in a closed room, right? Outbreak may also occur following exposure to chemicals or to radioactive materials. I don't know if you have covered food poisoning. Have you covered food poisoning? Have you covered food poisoning? What is food poisoning?
Not yet.
You haven't covered.
Yes.
So you don't know food infection and food intoxication. You don't know what is it.
Of course. Yes.
Okay. So outbreak may also occur following exposure to chemicals. When we are talking to chemicals, it can be heavy metals or it can be mycotoxins. But we have food infection and food intoxication. When we are talking about food infection, is that it has microbes, and those microbes, they are the ones, they are pathogenic microorganisms, so they can cause illness. But sometimes microorganisms can produce toxin. So microorganisms maybe will not be there at that time, but they produce toxin, which that toxin can cause food poisoning. And that's where we're talking about food intoxication. When we are talking heavy metal exposure, it's like exposure of lead. We are talking heavy metals exposure in vegetables, whereby sometimes they grow vegetables near the industry and they use industry water, which is contaminated with heavy metals. Or it can be contaminated, food can be contaminated with mycotoxins. Mycotoxins are toxins which are produced by fungi. That's why they are called mycotoxins. So they are produced by fungi or molds. So, and mycotoxins can be found in maize. And here in Tanzania, it has already been reported people who have died because of mycotoxins in maize. I don't know if you heard that outbreak, which was occurred in 2016 in Dodoma and Manyara, whereby people lost their lives because of eating ugali, because ugali was contaminated with mycotoxins. So those are the exposure. And we have that vivid example of mycotoxin exposure in Tanzania. But we also have communicable disease outbreaks. Several environmental factors influence the spread of communicable diseases that are prone to cause epidemics. The most important of these are water supply, if water is contaminated, sanitation facilities, food or climate. All these can also be a source of communicable diseases. They can expose somebody with a pathogenic microorganism or with some of the pathogenic microorganisms that can cause disease, infection to somebody. Investigating outbreak is a challenging task. It is not easy, but you need to understand how to do that as a nutritionist. Steps in investigating outbreaks. The classical 10-step approach includes 4 main stages. Confirmation of the presence of the outbreak and diagnosis using laboratory tests. First, when we are talking about outbreak, you need to confirm, is it really an outbreak? Do we really have that outbreak? And what is an outbreak? That we are expecting that disease to occur in higher rate above normal in a certain period of time. How can we confirm that? Maybe it can be through diagnosis using laboratory tests, or you can have a lot of admitted patients with a certain disease with a higher rate of admission, and then you will know that there is an outbreak. After that, another important step is generation of hypotheses regarding causation using descriptive epidemiology findings. When we're talking about descriptive epidemiology, we want to know when was it occurred, who were accepted, the time, the place, where, when, who, where. So those are the descriptive findings. By having those descriptive findings, then it will be possible for you to generate the hypothesis. Because like when you see that a lot of affected people are of the age below maybe 6 months of age, and then you will say maybe there is an issue from the breast milk, because these they don't take complementary foods if they are below 6 months of age. Then those hypotheses will make you be able to start planning your investigating plan. Like now, then we are going to investigate only mothers with children below 6 months of age. Or maybe you can find out the mostly affected are the adolescent girls. And then you will say, then we have to start interviewing these girls with their mothers. So that's how we are generating the hypothesis with regard to the confirmation test, with regard to the diagnosis of the laboratory test. After having the hypothesis, another important step is to test the hypothesis. How do we test the hypothesis? Is by using analytical epidemiological techniques. Now you have to know if the cause maybe is from the food, then you can go and say, then we are going to assess 24-hour dietary recall before the onset of that symptom. Or if that, and then from the 24 hours dietary recall, you will get the type of food which were consumed, and then you can be able to identify majority who were admitted with this exposure. They consume maybe a certain type of meat. So it will be able for you to analyze and come up with the proof of your hypothesis and confirm maybe this was caused by this and this and this. And after that, you can have now right to plan what will be your intervention measures, prevention measures, how to control. So those are the main 4 steps. But generally, there are 10 steps which you will also cover. So in this lecture, you'll be able to provide general overview of the basic steps of disease outbreak investigations and investigate the disease outbreak. Types of disease outbreaks investigation. For any disease, occurrence of an outbreak reflects a change in the usual relationship between the host, the agent, and the environment. The host is the individual immune function, lifestyle, nutrition, exposure. That's the person who is affected. The lifestyle, nutrition, how is she or he like behaving, working, eating. But then there is the issue of the agent, the causative factor. Is it the microorganism in a certain food? Is it the toxin? Is it a physical force? Or is it the climate? When we are talking the environment, we are talking about the climate, the crowding, poverty, social condition, or any other factors, environmental factors that can facilitate that disease to occur in that particular place. So each of these three factors and their interaction must be investigated and understood. If this is not done, then the control measures are not based on the best scientific evidence. I think you have already heard that nowadays in everything, if you want to do, they said you need to have evidence-based data. You cannot say that there is an outbreak without having the evidence-based information about the host, about the agent, and about the environment. Traditional approach of investigating disease outbreaks, the disease-specific experts investigated outbreak by counting cases, analyzing laboratory specimen, and conducting other environmental studies as needed. Such investigation required subject expert in the pathogen or toxin that caused the outbreak. So that was the traditional way of investigating the diseases. If you have a laboratory scientist that can analyze the sample and say, oh, in this sample there is this pathogen. So they needed that expert in that pathogen or toxin of interest in that outbreak. But nowadays we are using systematic field epidemiology method. So the current field epidemiological method make use of quantitative data generated from a study of relationship between the host, agent, and environment, and compare exposures in the outbreak cases to appropriate comparison groups to come to evidence-based conclusion. Because if you are saying that this particular group is suffering a certain condition because they are chain smokers, you need to compare your results with another group, that's the non-smokers group, so that that condition should be noted in higher level in the group which is from smokers. So from there, people can understand it very well. So usually call for collaboration with other disciplines. For this case, for the field epidemiological study, you need to have a statistician who can say, in order to come up with reliable and acceptable results, you need to have a certain number of samples. We cannot analyze from only 30 people. We need to have 100. Why? Because rate of occurrence of that disease is not that big. So we need large number of samples. And that can be obtained from a statistician. But the laboratory experts will supposed to be there in order to analyze the samples collected. But also we need environmental specialist, maybe. He will say, maybe during this season, there is maybe movement of water from a certain river to this, and that's where maybe they collect water from a certain point, which is contaminated, and blah, blah, blah. But also you need a clinician who will be able to assess the clinical symptoms for that particular condition. But also you may need maybe to have an entomologist. Why? Because you don't know a particular doodle which was involved. So entomologist will be able to study that particular doodle which can cause that disease. Those are mentioning few professionals, but a lot are required. Like you can also need a nutritionist there. Why? Because you want somebody to assess the nutritional status of that particular community and to be able to identify the cause of that poor nutritional status is what? Is it because of only dietary, there is no food, or is it because they are poor, or is it because that the food is not available, or they don't have knowledge of nutrition? So they have food, they have money, but they don't know how to plan the meals. So you can see how systematic feed epidemiological methods involves different specialization in order to come up with reliable results. A systematic step-by-step approach that includes confirmation, I've already mentioned, generation of hypotheses, testing of hypotheses, and planning for a control. So when you have to investigate an outbreak, what really do you have to do? First, you need to determine the existence of outbreak. If you are told that there is an outbreak, you first have to confirm. What do you need? You need to know if there is existence of the outbreak, characterize the cluster of cases, compare the current incidence with the background rates. So when you compare the rates, you know that it's okay. Now the rates are higher. It is 20 times more than the way it was in August. So that means there is an outbreak. And then confirm the diagnosis, description of clinical picture, the frequency of signs, the symptoms among the cases. After that, you define a case. Specify criteria. Here where we are talking about descriptive epidemiologists. Well, when we talk about descriptive, that's where you have to define specific criteria. Who are affected, where, like residents, when, the date of onset. So with these descriptive characteristics, you will get a picture so that you'll be able to generate your hypothesis. After that, search for cases performed consistently and uniformly in the area of the outbreak to generate an accurate assessment. How many are affected in that particular area? It's true that you have an outbreak. It is true because the clinical, the laboratory results show that there is this and this and this, and you have the clinical signs, but also you have already defined the case and know that a certain age is the one which is mostly affected in that particular area. But then you have to go there and look for the cases so that you have appropriate, like accurate number, we can say, of and then after that, you generate hypotheses using descriptive finding, an epidemic curve showing the distribution of cases by dates of disease onset, place, map or geographical area, and person, incidence by age and by sex. After that, you have to test your hypothesis with an analytical study, quantitative comparisons to determine whether a particular exposure or risk factor is associated with the occurrence of a disease. So you have to find out the risk factor. And then after that, you draw conclusion, strength of the association between the possible causes and the disease of interest. Like you can say maybe 90% of affected person, they ate ugali before the onset of the symptoms. And then you can go back and find out if 90% they said that they had ugali a day before the onset of the symptoms. Then you can go further and finding their maize flour. If is it maize flour? If yes, then you collect the maize flour and try to analyze what is in the maize flour. Statistical significance of the association. Then is it statistical significance? What about those who have not eaten the ugali? How many are they? Are there any difference between those who have not eaten ugali with those who have eaten ugali and the symptoms? Are there any statistical significant differences? Proportion of cases that will be adequately explained by this association. Temporal relationship of exposures with the outcomes. biological plausibility of the conclusion and its consistency with other studies. Because at the end, you have to show something which you have evidence, like maybe this has occurred, like a certain study which reported this and this and this in certain cases. So for that case, people will be able to compare and accept your conclusion. Conducting additional investigations. You have your hypothesis, you have come into conclusion, but we can also have additional investigation in order to find out maybe a vector or microbiological investigation that a source was ugali. Then you can go to do further investigation with the maize flour to test the quality or maybe of the water, and environmental investigation to understand how the preparation of food item led to a foodborne outbreak. Communicate finding. For communication of the finding, it is also covered in another chapter of how to communicate, because it depends whom you are going to communicate to. Is it a policymaker? Is it a scientist group? Because if it is a scientist group, then you need to present your scientific issues with the names of microbials, contaminants, and all other scientific terminologies you can use in your presentation. But if you're going to talk to a policymaker who is also not a scientist, is a politician, then you know how to present your findings. If you put a lot of bombarding scientific terminologies, nobody will listen your finding. So you need to understand very well how to communicate the finding, the audience you're going to communicate to. Execute prevention measures. So if you're supposed to go and do the prevention measure, then you have to plan your prevention and control measures. Are we together?
Yes, madam.
I can see the time is over and you're supposed to go into another lecture. Or don't you have another lecture from here? I can stop here and remind me during knowledge area 2 to start from chapter 4, or I can continue fast if you don't have another lecture coming. So it's up to you to decide.
Continue, madam.
Okay, chapter 4 is about, I'll go a bit faster. Chapter 4 is about descriptive epidemiology. Descriptive epidemiology is one of the basic types of epidemiology which is concerned with describing the frequency and distribution of diseases and other health-related conditions by time, place, and person. I've already mentioned to you about the descriptive epidemiology, that you describe where, who, when. So it is time, place, and person. At the end of this lecture, you should be able to discuss factors influencing various diseases, describe the occurrence of diseases, explain the 3 components of epidemiological trial, discuss the different risk factors for disease. The major variables in descriptive epidemiology is time, it is seasonality, place, it can be place of residence, it can be birthplace, it can be place of employment, it can be at school or hospital units, geographic units like country, state, county, street, map coordinates, etc. So anything that can define a place. So you are the ones to define the place. So if you want to assess maybe exposure of chemicals for those who are working on the flower farms, and then a place can be the flower farms in Arusha. And when we are talking about place, it has an effect with exposure. As I've mentioned, if you're talking about exposure of chemicals in flower farms, that means place of exposure, it will be at the flower farms. But when we are talking about time, that is seasonality. So it depends at what time that exposure occurred. What makes that exposure to occur in a certain time? But then we also have person. There are so many factors that can differentiate us from one person to another. We have age, we have race, like African and white people. But age, we have adults, we have young children, we have adolescents, we have reproductive age. Also, we have sex, where we have men and women, or I can say male and female. But person can also be socioeconomic status. We have those with a very high socioeconomic status compared to those families with very low socioeconomic status, and that can affect their personality. And also that can also be a factor for exposure of a certain disease. So when we are talking about descriptive epidemiology, you need to remember about time, place, and person. Who, where, and when. So factor influencing diseases, we have primary cause factors, which they are necessary for a certain disease to occur. For example, when we are talking malaria, you need to have malaria parasite, the Plasmodium. Whether you do what or what, but somebody, if she is suffering from malaria, that means she is exposed to malaria parasites, the Plasmodium. But also, another factor that can influence disease is other risk factors, not necessarily causes of the disease, but they are important for a disease to occur. Rajabu, please mute your iPhone. The etiology of disease is the sum of total of all the factors, the primary causes and risk factor, which contribute to the occurrence of the disease. And that's why I was giving you the example of malaria. For example, malaria is caused by Plasmodium. But in order Plasmodium to be present in the mosquito, you need to have favorable condition for the mosquito to breed, to be contaminated with the Plasmodium, and then to be able to cause malaria. How? Maybe you are not using a mosquito net. So that environment favor the malaria mosquito to bite you and introduce the Plasmodiums. So you can see all factors are very important in the etiology of a disease. They contribute to the occurrence of a disease. The epidemiological triangle, we have agent, host, and environment. Agents are microbes, virus, bacteria, parasites, or other microbe, chemical, etc. Generally, these agents must be present for a disease to occur. These must be present for a disease to occur. And then we have host. This is intrinsic factors that influence an individual's exposure, susceptibility, or response to a causative agent. For example, age, race, sex, socioeconomic status, and behavior. For example, when we're talking about maybe sexual practice, it is obvious not for the younger children. It is for the adults or from adolescents and above. When we are talking on contraceptive, that is for those who are at the reproductive age. It can be for both men and women. They can do, they can know how to maybe to work on it in order to protect unwanted pregnancy. But also we have the issue of like eating habit. We have the issue of other behavior like smoking or drug abuse. So something like that. And that differ from one person to another. But then we have environmental factors, and these are extrinsic factors which affect the agent and the opportunity for exposure. Generally, environmental factors include physical factors such as the climate, the geology, and physical surroundings. As I mentioned about stagnant water for breeding of mosquitoes. Agent, host, and environmental factors interrelate in a variety of complex ways to produce disease in